some physiology of the heart. So within the heart, a cardiac cycle is one complete heartbeat. The contraction of a heart chamber is called a systole, while the relaxation of that chamber is called diastole. And this, I'm not going to play this all. It's really awful, but just a funny way to tell you what the aortic valve is doing during both of those.
Physiology during systole. The aortic valve is open. Physiology on diastole. The aortic valve is closed.
All right, hopefully you get that. I can't take much more, but that was Mr. Rogers' uncle, so we threw a little quick hit on his video there for him. So, keeping those in mind, the systole and diastole, blood pressure cuffs, and we're going to hopefully get the stuff in time to do a lab with this, but I can't promise, measures the force of blood in the vessels. And during systole, the force is the greatest because the ventricle is contracting. So it's pushing the blood, so you're going to have a higher pressure. During diastole, the number is smaller because that's when the ventricle relaxes. So an average blood pressure is 120/80. And then you can see some others slightly lower and slightly above. So again, 120/80 is an average for us humans, but it does vary by person, so it's best if you find out kind of what's normal for you from your doctor. You might be 130/90, and that's normal for you. Somebody might be 110/70, and that's normal for them. But when it's not normal, whatever your normal is, if it gets away from that, then that's when you want to worry about that with your doctor. And hopefully we will get these in time, and they're called a sphygmomanometer, and that's going to measure our blood pressure, but we'll practice how to do that. So when we say blood pressure, it's actually the force of blood against the walls of the arteries. And again, it's highest during systole because the ventricle is contracting, increasing the pressure, and actually pushing the blood out. I'm sure you've heard the heart. Hopefully we get these in time too. They make a lub-dub sound, and that's the valves, those semilunar, bicuspid, tricuspid, those valves opening and closing. A normal resting heart rate for adults is 60 to 100 beats per minute. Like if you're an athlete, cross-country runner, for instance, your resting heart rate is probably lower than 60. And that's a good thing. It's good to have it as a lower one. If you're really out of shape, maybe older, overweight, you might be 110, 120, putting your heart at a little more strain. Hopefully in the lab we'll be doing this as well, measuring pulse. And the pulse points are just places where your arteries come close to your skin on your body, so it's easier to find pulse. And you could do it right now. Your carotid artery is located like on the left side of your neck, where it kind of meets the throat. So under your chin, put 2 fingers, press them inward, and you'll feel it pushing back. That's your carotid artery. That's you're feeling actually when each time your heart beats. Radial arteries are on your wrists, brachial arteries on your arms. So if you were in class, we'll do that. Hopefully you'll get to do it on the lab. So go ahead and press pause while you put this in your notes. So a conduction system, like how do we trigger this? What happens? How's this all work? These are the terms we'll be talking about. And you'll see them here. You have the pacemaker, starts it off, sends an electrical signal to the atrioventricular node, which picks that up and causes the bundle of fibers to cause contractions. We'll throw that in your notes there. So how do we regulate the cardiac cycle? Well, your heart rate, the cardiac cycle, is controlled within that part of the brain called the medulla oblongata. So we talked about that when we were doing our brain anatomy and physiology. So you can kind of see it here. It's in the brainstem, the region here, and that's going to be what's responsible for controlling the autonomic function of heart contractions. It will increase or decrease as a response to change in homeostasis. So, obviously, if you're, say, going for a run, well, you need more blood. Your heart's going to pump faster. When you sleep, you're not doing much, so it's going to beat much slower. So the major blood vessels of the body, arteries, which we said in the heart carry oxygenated blood away for arteries from the heart. Veins carry deoxygenated blood back to the heart. And capillaries are kind of where arteries and veins meet tissue. So we have exchange of gases and wastes and things like that. Which is more specified here. So when we have oxygen nutrients being exchanged between blood and tissues, it's happening at the capillaries because they're small. They're very thin and small, much smaller and thinner than the arteries and veins, so it allows for quicker diffusion of gases. What controls the blood flow? Precapillary sphincters. They're circular, they're like valves, they're muscles though, and they're at the place where artery and capillary meet. And two things can happen at these sphincters. You can have vasoconstriction, which means your blood vessels get more narrow, or you can have vasodilation, meaning your blood vessels get more wide, they expand. And again, it's doing this based on senses it's receiving from the brain of either we need more blood, vasodilation, or less blood right now, vasoconstriction. And they can do that at different parts of the body. One part might be getting vasoconstricted, and one part may be getting vasodilated, arteries at the same time. And those sphincters can open and close as well. Blood flow through the veins is not very efficient. It's pretty slow. It's weak because it's not controlled by the pumping of the heart. That's pumping of the heart is pushing things out through the arteries, but getting blood back to the heart is not as efficient. It's not as easy. So things that happen, your diaphragm contracts, that helps it. The pumping action of your skeletal muscles helps it, and there are valves in the veins to prevent backflow. Once we've moved some blood towards our heart, we don't want it to slip and go back further away. So go ahead and pause while you put this into your notes. Blood clots. We talked a little bit about them in the blood section. We said that clotting is a good thing when it's preventing like blood from leaking out of your body during a cut, but it also can occur when blood doesn't flow properly through the veins. So if a person is sedentary, meaning they don't move enough, sometimes they can form a clot, and that can be deadly in some instances, like embolisms where they go to your heart or lungs or brain. So major blood vessels in your artery, we already know about the aorta. There's different parts of it that go different places. The pulmonary trunk, well, pulmonary means lungs, so this is the part that's going to go to the lungs. Your pulmonary veins are going to take blood from the lungs back to the heart. And then your superior and inferior vena cava return blood from the head and body to the heart. Remember, superior is coming through the top part, inferior on the bottom, going back way to our early terms. And in our aorta, we have different regions of that even. If you notice up here, these are all branching off the aorta. You have coronary arteries that are going to go back and supply blood to the heart itself. It needs a constant supply of blood because it's oxygenated. We need the brachiocephalic artery, which is going to branch into two parts. The right subclavian, which is going to go to the arms. The right common carotid, going to go to the neck and head area, as well as the left common carotid. And here's just a picture of all those in greater detail. Go ahead and put that in your notes, and then you are done.